Welcome to My Therapist is Out. Each episode, we talk with a therapist from Open Space Therapy Collective or LGBT community members about mental health and building community. I'm your host, Renae Johnson, licensed therapist and founder of Open Space Therapy Collective, where we are your hub for queer and trans mental health care. As we dive into today's topic, please keep in mind that this is a mental health podcast. We will talk about sensitive and difficult issues that are not appropriate for all audiences. Please take care while listening. Hey, welcome back to My Therapist is Out. I just want to start out by saying that the fires in LA have been really devastating, and the team at Open Space Therapy Collective and I are here with you. Our team and the clients that we work with have been effective. Thankfully, everyone on our team is safe and their loved ones are safe. We have partnered with the LA Queer Events Coalition and are putting together an event on Saturday, January 25th. So this coming Saturday at the AT Center from 1 p.m. to 4 p.m. to really come together as a community to heal, to provide education around how to recover from the fires, the different things that you can do. We will have 15 to 20 therapists and wellness counselors there that you can spend one-on-one time with. You can process the grief and loss that's happened. You can talk about the inauguration that just happened on Monday, which is really heavy. And we will have resources for people who were affected by the fire. We'll have speakers to help educate. We're going to have a lawyer. The Human Rights Campaign is going to be there. We'll have Aaron Burns with the tax agency there to talk about how to assess disaster loss. We'll have a crisis case manager there to talk about next steps and the resources that are available to you. There will be a ton of different organizations tabling. If you haven't been deeply affected by the fires, there'll also be opportunities for you to sign up and volunteer. I know a lot of people in LA are hearing that the organizations are overloaded with donations, which is incredible. It's a real testament to how LA can come together. And it's really hopeful in this next 4 years of this really hateful presidency that we're stepping into, that the community in LA really can come together and make things happen. And so there'll be organizations that will help you figure out how you can volunteer. Donations of clothing and things like that aren't needed anymore. Water, masks, feminine hygiene products, toothbrush, toothpaste, all of these things are still really needed. The YMCA in Pasadena is a big player and really close to the fires that hit in Altadena. So please come join us. It's completely free. Our team will be there from Open Space to help support you. There's a community yoga event afterwards. It will be an inside-outside event, so there will be both. Please bring a mask. We will have masks there, and keep yourself safe. That being said, we're going to dive into today's podcast, and this is a little heavier one and really in line with everything that's going on. So I recorded this with the mental health team at Kaiser before Christmas, and so we referenced that they've been on strike for 6 weeks. It is now week 14, and Kaiser has refused to come to the table and negotiate to provide decent pay. And so the mental health team at Kaiser, which is therapists, social workers, hospice workers, psychiatric nurses, psych case managers, everybody who's providing mental health care is in this union. And SoCal Kaiser has refused to give them the same pay, benefits, workload that NorCal Kaiser gets. So the crew in San Francisco gets different pay, different breaks, different caseloads than SoCal Kaiser in LA and the surrounding areas, which is bananas to me, but very on theme with everything that's happening with the case in United Healthcare and the insurance companies dropping all of the fire home insurance from the people who've lost their homes in Altadena and the Palisades. And we really get into how these insurance companies don't care. They're there to make a dollar. They don't care about providing quality care. They do not care about treating their staff well.
they have millions and millions of dollars set aside to pay for lawsuits because they would rather do that than provide quality care. And so we talk with two of the Kaiser team, and I'm speechless now, and I was speechless during this conversation. Both of these people do great work. I was very inspired to be able to talk with them, and we're going to dive in. I do want to highlight, this is week 14. And so Kaiser has not been able to provide quality care for 14 weeks. They refused to come to the table until 12 weeks in, which was after the holidays. Part of that is they are trying to wait out these poorly paid staff that they know don't have the savings, don't have the resources to do a long strike. And a lot of people had to go back to work. And because they waited so long, when these fires hit and the Kaiser patients needed extra support, the mental health crisis was exacerbated, which is hard to believe that's even possible. But it's heartbreaking to watch. So they are supposedly having negotiations on Thursday, the first round. We'll see what comes out of that. This strike could last for quite a while. I hope it doesn't. And we'll see. But we dive in. It's a little heavier. Just as a forewarning, we're not going to do the queer moment of joy this week. It seems a little off key with the fires, the topic of today's conversation, and the recent inauguration. Although I do want to say queer joy is a beautiful way to rebel against the system. So we will definitely bring that back for the next episode. Anyway, dive in. Let me know what you think. This is a heavy one. Please come and see us on the 25th, Saturday, 1 to 4 at the AT Center in Silver Lake. You can go to our website, openfaceptherapycollective.com/events, and there'll be more details and links. Hope to hear from you soon.
Welcome back to My Therapist is Out. We have a different episode for you today, and I'm really excited about it and think it's going to be really interesting for everybody. So typically we talk about mental health and different experiences that people are having, but right now the mental health team over at Kaiser is on strike, and their union is the NUHW. And we are lucky enough to have two of the mental health professionals from Kaiser with us. We have Gina Porter, who's a psychiatric RN, and Dr. Garcia, who's a hospice clinical social worker. Thank you both so much for being here and being willing to talk about this today.
Thank you for having us.
Can you both introduce yourselves and what you do with Kaiser? You both have really unique perspectives in the mental health field.
Okay.
Gina, go first. Go ahead.
So I'm Gina Porter. I'm a psychiatric RN. I started with Kaiser back in 2018 as an LVN, or licensed vocational nurse. Later on, eventually got my registered nursing degree and license and transferred into the psychiatric RN position. So what exactly does a psychiatric RN do? So we're basically the bridge that is responsible for the communications between a patient and their psychiatrist. So we work administratively under your psychiatrist, and whenever you email them, you send them messages, you call in. We're one of the first lines of medical assistance that you will speak to in regards to medications, medication reactions, or just other information that you might need that your psychiatrist can't get to at that moment.
Well, it sounds like you're really involved in kind of the moment to moment with the clients that you work with.
Yes, so we actually, depending on how much of a relationship a patient has with their psychiatrist, we develop that same relationship also, because a lot of our patients, like I'm in the Riverside area, and a lot of the patients will know us by name. They'll know each of their psychiatrists' main nurses. Your psychiatrist may have 1 to 2 RNs that support them and maybe about 2 to 3 LVNs that support them. But when it comes to the major issues, or if you experience a psychiatric emergency, we have to be able to assess and triage you over the phone and be able to guide you from there. And also we're responsible for informing you of resources that you have, like the therapist, like what, Dr. Jarrett does, and things that you may need within the Kaiser system.
How long have you been with Kaiser?
I've been with Kaiser since 2018. I've been in the psychiatric RN role since November of 2022, actually.
Okay, cool. it sounds like and we'll get into this, but it sounds like it's been a really interesting transition for you. Dr. Jared, what about you?
Yeah, so welcome everybody. I'm Dr. Jared Garcia. I am a hospice clinical social worker, so I'm a licensed clinical social worker. I have been with Kaiser, this is now my 14th year, and I have been in the same department this whole time. So I've been started with Kaiser on that one job, and I've stayed in that job for this whole time. So our department is called Care at Home, and basically what that means, it's a group of departments that come together. So home health, palliative care, and hospice. So when you think of anything of a nurse or a professional coming to your home, that would pretty much be our department. So whether it's for home health, for like rehab, whether it's palliative care and you have a prolonged chronic illness and nurses need to go in and see patients, or you're on hospice and you have a terminal illness, our department and our areas would provide those services. And for a hospice social worker myself, I provide obviously resources and things, but a lot of mine is focused on education and emotional support of people going through the process of, one, dying, and two, being a witness and being with your loved one who is dying. So that's kind of my role in hospice.
Amazing. I have a special place in my heart for hospice workers. They were incredibly helpful as my mother was dying a few years ago, and really like holding her hands through that process. So thank you to both of you for the work that you do. And it also sounds like you've both been with Kaiser for quite a while and are pretty invested in the work that you do there. A lot of people are really curious why you're striking and what's going on and what's the difference between Northern California Kaiser and Southern California Kaiser. I wonder if you two can set the scene of what's triggered this strike.
So with the psychiatric RNs, our situation is quite unique in the fact that we do not have NorCal counterparts. We're in a classification of our own. They kind of lump us in with addiction medicine nurses. Those are the people who specifically work for people who are detoxing off of various substances. Whereas psychiatric RNs we work with patients that encompasses all of the spectrum of medical care. Like you may have someone who is depressed because of a recent diagnosis of cancer or other medical ailments, or who might be experiencing anxiety, depression, or other symptoms related to withdrawing from substances. So we have to be able to help those patients, whereas other nurses are very, very specific in what they do. And the thing with us is we make up a small portion of the National Union of Healthcare Workers. We're 200 within this 2,400 strong union. And we're treated kind of like the redheaded stepchildren of Kaiser when it comes to nursing. One of the examples I do emphasize is that I am a 3-year specialty nurse, but I make less than a floor nurse who is a new graduate with all the other unions out there. Mental health is not something you can just pick up and go. Mental health is a different baby all on its own to take care of, because you have to learn different things. Like you have to learn your medications, you have to learn therapeutic communication, you have to learn boundary settings, you have to learn to kind of in a way be extroverted, because you're talking to a wide variety of people, cultural differences, our rainbow community. I mean, so many sensitive populations that you are working with that you have to be knowledgeable about and tailor, their care based on what they're experiencing. So a lot of people don't tend to see what it is that we actually do. And I'm striking because there are things I lost. Like I've mentioned it before, but Kaiser really has this thing where they push upward mobility. But when you're a psychiatric RN, there really is no upward mobility for us. We're literally stuck in this role. That's why you'll notice a lot of psychiatric RNs have not moved into management. They haven't moved upward because there is nothing for us if you take a look at the other nursing unions, they have other positions. They can move into other specialties. For us, it's just that because of how Kaiser hires and how they promote from within. Another thing is like, when you listen to the Kaiserization of, yeah, go get your degree, go do this, you'll go far, and you do it, and then you fall into a department like psychiatry or behavioral health, you're going to give up benefits. I had to give up my pension once I crossed over into this new position. I am now stuck in a lower wage scale than my other nursing counterparts. Again, I have no ability to move anywhere up from my position. I have to hope a nursing manager position becomes available, and there's only a handful of those positions. Other than that, I'm stuck with what I'm doing for Kaiser as long as I stay in this department.
That's baffling. Like,
that is.
You're saying this and my brain is breaking a little bit because it sounds like Kaiser was like, oh, hey, get your degree, move up. You were like, okay, I want this really specialized RN license and work in psychiatric care, which is so complicated because you have to know the medical piece and the mental health piece. So it's kind of like a dual specialty. And then they're like, congratulations, now we're going to pay you less. We're going to take away your pension. You're stuck in this position. And we're not going to listen to anything that you need to do your job.
No, and there's not enough of us to serve the psychiatrists. Members, when they email their psychiatrists, 99% of the time, they don't know that it's a nurse who reads it first. They think they're sharing intimate details of their crisis with their psychiatrist, but no, it's somebody like me who's sitting there reading it, and then I have to call you back and assess. And God forbid, I'm out on sick leave, I'm out on vacation. There's not another nurse who can back me up half the time. Or if I come back from these leaves, or another nurse comes back from their leaves, they don't realize that I'm supporting 3 full-time doctors, each with a patient load of 2,000 to 3,000 on their panel. So I can't get back to your message in 24 to 48 hours like I would really love to. And so a lot of them are like slipping through the cracks because Kaiser refuses to hire more nurses.
Right.
And even if they would hire, the fact that everyone knows that you're going to lose your pension, you're going to make less than everyone else. And there's no any sort of promotional opportunities for you. No one wants that job.
Okay. We're going to dive deeper into this.
Yeah. I just wanted
Jared,
to piggyback on a couple of things. Yeah. So as the poster behind me says, FAIR is crossed out, and really you may not be able to see it, but this strike is all about equity for our union. So like Gina said, there's 2,400 of us. So I don't know if your listeners know, but that considers social workers, MFTs, licensed counselors, psychologists, nurses, and we're all in different areas of wherever you can think these positions can be, that's where we are. So the social workers where I'm at, in the hospital, right? The social workers in the hospital. All of us are just trying to get equity. And the question is equity for what? Like Gina said. So there's over 1,700 of our union members who do not get the pension. I'm one of the few who've been here the longest, who was kind of basically grandfathered in. But when new hires come on to Kaiser, we are one of the few. There's only really one other union that's just a small group of pharmacists who don't get the pension. But everybody else through any Kaiser in anywhere in the United States gets a pension. So it's huge, right? So, and when we're talking about what that looks like, so when I go into my clinic or any of our people go into their clinics and they see the receptionist who answers the phones, they get a pension. When the janitorial staff takes out the trash, they get a pension. The people who fix the computers and the equipment, they get a pension. But the person who's actually doing the work and the therapy with the one-on-one or the psychosocial support, they're not getting pensions. And so we're really just asking for the same things that Kaiser has already provided every other union. That's pretty much what we're asking for. And our sister union up in Northern California gets protected time. And all of your therapists will know how important that is right? You can't just see a patient after patient after patient and not have protected time to do a note, to be able to call them back, like Gina is saying, because the therapists and here's the difference. A doctor gets support from a nurse. A therapist does not have support staff. So basically, Gina's job is distributed to another job that the therapist must do on their own. Right. And Kaiser doesn't give them any protected time. But our Northern California people do. So they got a contract last year. And that's what this fight is about, because they're not even giving us the same as Northern California got.
Wow.
Right? It's just
mind-blowing. So for some of our people, some of our listeners who are like junior therapists or aren't professionals in the field, protected time is, like you're saying, that 10, 20 minutes after sessions or bigger breaks during the day where you get to do documentation, do documentation because we need to say we saw so-and-so for this thing and we recommend that they continue to receive treatment.
Yes.
And it's important for our clinicians to have that time, because even though I'm not someone who actually needs it, I talk to these same patients, and when they have to repeat themselves, it feels disingenuous on the therapist's part, because it makes the patient feel like they're not being heard, or you don't care about their problems because they just told you this in a session last week or 2 weeks ago, and now they're repeating it again. And the patient wouldn't have to repeat themselves or go over the same thing if the clinician had enough time to actually review their chart and know what the session was about the last time they saw that patient, and become more familiar with what they're going to be talking about in that particular session.
Which is something we hear from clients that have had Kaiser care before. It's not so much that they're upset with any individual provider, but across the board, they just feel very neglected. And like you're saying, if you're responsible for 3,000 or 9,000 patients and responding to those emails, if you are just seeing clients back to back to back to back, it's impossible to provide not even quality, but just basic care.
Bare bones, just bare bones. And we have people who are in specific programs called ADAPT, which talks about, it's an acronym for anxiety and depression patients. And those appointments are only 30 minutes. So with those appointments right? So we also have another issue to just being 30 minutes, right? But with that therapist, and you're talking about junior therapists, that's what most of them are in this program, accruing their hours and trying to, get their feet wet. Well, they could have up to 14 patients in a day with no protected time to do their documentation. So when the public and when people hear, right, because they're putting things out in the LA Times saying that our union is greedy and that our union, what we are proposing about protected time, is going to diminish patient care, me and Gina will be the first one to say, you're absolutely right, because Kaiser likes the status quo of one therapist not even having time to go to the restroom. Because if she goes to the restroom, she's going to be late for her next appointment, right? So we're saying that's absolutely right. And if it works in Northern California and Kaiser management over there understands that there's a need to have protected time for the patients, because, let's be truthful. There are times when patients don't show up, right? Absolutely no shows. That stuff happens. But we're not in Vegas gambling to hope and pray that you get please, just 2 people not show up today, please, so I could just have a break. And that's what Kaiser's banking on. And we're basically saying, no, we want equity, and we want the same things that is going to instill and reinforce patient-centered care. That's what we're asking for.
So right now, Kaiser's current practice, the way I understand it, and I want someone to correct me if I'm wrong. So right now, Kaiser is not offering our clinicians enough patient management time. And whenever they do get patient management time, management can go in and take what patient management time they have based on something called net loss. Net loss is something that these clinicians are being penalized for, because from what I understand as a nurse, it's net loss is calculated by how many no-shows you've had for that week. And so what's happening is these clinicians, if they have a net loss higher than 10% for that week, management comes in the following week and snatches their patient management time slots and puts, whether it's intake, follow-up visits, or whatever the case may be, into that time that they need to review their charts because of something that happened that was not within their control the week prior. So our clinicians are being penalized, strongly penalized, over something that's not their fault. It's they can beg and plead as much as they want with patients to keep their appointments or call ahead to cancel their appointments, but they can't control what happens outside of appointment times. And Kaiser just does not care. They're just saying, oh, well, you should have tried harder. Here's an intake for you. Never mind that clinician has already had 13 patients that day. Here's another hour intake for you because your patient failed to show up the week prior. Not your fault. We know that, but we got to keep our numbers up.
I said this to Jared before. I was like, there's going to be moments where I'm just speechless. Like,
Completely.
that can't imagine. Like, part of being able to provide decent care for people is being able to have the room to breathe and think and plan your day and know who's in front of you and coordinate with other offices and other professionals. And I'm sure the interdepartment coordination that you need to do, it doesn't sound like you have time to do that. I mean, the fact that you're even can I go to the bathroom?
And having to think that in your head, if I go to the bathroom now, maybe I'll only be 3 minutes late to my next appointment. You have to calculate that out. People have to calculate that out. Or you know what? And this is the issue because also too, they're not hourly employees. So Kaiser loves this because guess what? It is your responsibility that at the end of the day that all your documentation is done. So guess what? 5 o'clock comes around and you have an hour of documentation that you got to do because you were booked back to back to back with appointments, and to your point where you're talking about centering yourself and doing that, me and Gina are actually on the bargaining committee. So we are going across the table, with management, hearing their responses. And one of our members said directly to management across the table, telling them directly, I don't think that you understand that we are actually human beings that time after time absorb trauma throughout the day. And we, as people, need to be able to cut our cords, be able to ground ourselves, and be able to come back to a place where we can take a couple of deep breaths because we're human, right? We're not a factory. We're not something that can just go, 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 go. And that really hit people, differently, but they don't seem to be getting the message yet. So
no, they think it's so easy, and they don't. Even with what I do, again, I work hand in hand with the psychiatrist. So if you send your psychiatrist a message, I've done everything I'm supposed to do on my end. But God forbid your psychiatrist takes 5 business days to respond. Guess who gets the brunt end of that? I do. My colleagues do. And sometimes even we have to take a step back and go, I need a mental health day, because especially if you work for our CAP, which is child adolescents providers, you are dealing with parents who are each advocating for their child. And when they're frustrated that their child's not getting their ADHD medication on time, or they need a school note that is time sensitive and your psychiatrist is not responding, the RN is going to get the brunt of that.
Yep.
And
absolutely.
Kaiser just does not care that they're stressing people out. To share a personal story, I've been with my department for 2 years. My first year, I was so stressed out, my waist length hair fell out until it was barely past my shoulders. And I showed this to my manager. Do you think she cared? I cried. I said, how are you guys mental health managers, but you don't care about your employees?
Yeah.
You don't care enough about our mental health. A lot of our staff are on stress leaves.
Yep.
It's too much.
And by the time you're getting those symptoms where your hair is falling out, it is bad. That is that is so. Now you're working in a traumatic environment. This isn't just like, oh, it's a hard day at work, I have a hard job. That's like a traumatic work environment. And it sounds like Kaiser's really chosen this specific behavioral health union to target and say, you guys need to work in conditions that are not humanly possible, and we're not going to give you the pay and benefits to actually live a life.
Yeah. No, and they keep talking about how they're offering 18% above most market values. What they're not explaining is that for 5 years, these members did not have a contract. For 5 years, they never got a pay raise. They kept on showing up to work, taking care of members, because again, it was patients over profits for a lot of our providers. And the fact that Kaiser wanted that's the reason why, our union is asking for the 30%. It's to make up for the 5 years that the clinicians did not get raises. And Kaiser is just not admitting that they did not pay these people. And even with what they're offering us now, it still would not make us equal with NorCal, Hawaii, or any of the other unions.
Yeah.
So that's really what it is. Just make us equal. Make us on par with everyone else.
And it sounds like stuff that they're already doing. So you're not even asking for, you're just asking for, equality. Like you're saying, I just want the same pay for the same work and the same benefits and the same type of work that somebody 3 hours north of us gets.
And since we've been on strike, right, the people who are the contingent workers, or what we like to call them, scabs, they're paying over $13,000 a week for 40 hours for them to do our jobs. $13,000.
Where do they get that money? If they need you guys to see... It just literally
comes from their cushions of money that they just have, right? And I think one of our members calculated it out, and she said if they go out on for like 10 weeks, that would be equivalent to what her annual salary would be.
Wow.
So you tell us, right, that, if you calculated all of that money and the meals, the hotels, and everything that they're paying these people, you really already had it there to begin with, to give us, And I want to kind of piggyback on also what Gina was saying about her personal story, and kind of give a little a highlight to hospice. Our issue is not really patient management time, but we're talking about chronic understaffing where we are. And so just to give people kind of an understanding, we're in San Bernardino County, right, which is the biggest county in the United States. And there's sometimes only one social worker who works a whole department. So what do I mean by that? So in Riverside, there's only one home health social worker who does Riverside County. So if that social worker is off or on leave, it goes to the responsibility of everybody. And this is Kaiser's famous lines. Let everybody just lean in. Lean in. Right? Yes. Right? Let's just lean in, guys. It's time to lean in. Right? So
I'm sorry, they're stealing a quote from somebody who's trying to help women in the workplace. They're stealing that to abuse labor. Oh, okay.
Yep. See, and it's a typical response. And so since I've been there, and I'm kind of like the steward for Care at Home as a group, there's 8 or 9 positions across Southern California that have not been filled. in all of the different areas. So San Diego, LA, Riverside, Fontana. There's so many people who have retired and they are not filling the positions at all. And
They're
so
just
then
leaving them open, and they have all of
leaving them
these.
open and hey, lean in. You know what? You can do it. The census isn't high. You know, just because you have to drive to Timbuktu, you should still be able to see 4 patients in a day, right? And they don't understand basic understandings of math, and that 8 hours a day is 8 hours in a day, right? And my commute from here all the way to Banning, because I'm in Ontario, is still going to be 50 minutes no matter what. I can't get that time back, right? And me as a steward and somebody who represents the union in my area, we had a girl who was going to go on leave because she was having a baby. Very excited for her. And I said to management very clearly, a storm's a-coming. What are you going to do, right? Let's figure this out. I worked with them for over 4 months before she went out. Did we get help? No, not one bit. They didn't want to hire anybody. They said, we'll figure it out. The day came that she left, we had it because we're hospice. And what management says to us is there's requirements. You have to see this new patient within 5 days or we're going to get dinged, right? And then they throw that on us as our ethical responsibility. And what we did was, well, it is unethical for me to provide inadequate services to the patients who are already on our service. Just because you put a new patient on that we told you not to, that falls on you, not on us, because we want to provide great care, above care for our patients. And, you know, to Gina's point, I was so upset, and I don't really get rattled with things very, very well. But I told them I'm going to go out on stress leave because if this continues, I can't do it because the patients are suffering and you're not doing anything about it. So it came to a point where I said, you know what? I can't handle it. And I went out on leave. And they had to deal with it even more back then because they don't think that it's important.
Yeah.
They don't think it's important. And patients will tell you, like, you know, you have your own patients who've had experiences with Kaiser who they're just horrible. And they rather just, you know what? Like Gina was saying, I'd rather just, if this is my child, I'd rather just pay extra and get a therapist that they can see weekly. Or you know what? I don't have to have that hospice agency and I'll just be referred out because I don't want to deal with all of this stuff. Like it's just too much. And those are the things we're trying to change in this contract strike. We're trying to all stand up to Kaiser and saying, no more, you can do better. You heard us. Why don't you just say, you know what? Yes, we need your partnership. We can do these things together and move forward to make patient care better and services better. Kaiser's been, and it's been in the news, Kaiser has been fined millions of dollars from, you know, DMHC. It's there. It's not a surprise. You can read it up. That's not my perspective on it. You know, that's not Gina's.
Wasn't there a like $200 million settlement?
$200 million.
That's just beyond the amount of money that my brain can understand. Yes. What was that for?
It was for a combination of things. A lot of it was because of Northern California. They weren't prepared for the strike, so they were canceling appointments after appointments after appointments. I believe some of that was like them kind of cooking the books a little bit of like return appointments and things like that, also of not having services provided adequately. And Kaiser said, yes, we know that we have, you know, pitfalls in areas, you know, that we have to work on. And that was before they even came to us when we were negotiating, right? And here we are. And patients have still been canceled. Patients are not getting the services that they want. So when people hear this in the news, we're out there and we're striking because we know that patients deserve better. So Gina was talking about providers like physicians, right? Well, we are actually considered providers because a provider means that you are licensed with the state, right? That's what a provider means. You have a number, you're a provider. But Kaiser doesn't treat therapists as like providers because a provider can see so many patients, right? Just like a physician. Hey, I have maybe 200 people on my caseload, and then you have to give all of the cases to somebody else. They don't do that. That's why people can't get a return appointment, like let's just say with me, for like 3 weeks. Even if I say, you need to give me a spot, I need to see this person within a week, they can't do it.
So in hospice, and this is very time bound because people are very sick and you have to be able to show up and like be with somebody as they're dying or try and help them have that quality of life. You can't do that if you can't return.
It's so challenging. And what we've had to do and kind of shift with hospice is we basically told them we can't take any new patients. So if you brought in a new patient, we cannot see that patient because Mr. Smith is dying and his wife is, is just not emotionally settling right now. And I need to take care of that because that's my patient. That's who I'm taking care of. It's not the new patient that came on, and that's not a clinical need just because you tell me I have to do an initial assessment. That's not a clinical need. That's your unethical choice to put them on when you can't provide a service, because we've just said, I can't see that patient. I will be able to see them in 3 weeks or 2 weeks, but I have all of these patients right now that need emotional and support. They need support. And that takes priority because that's the clinical need. That's what they need.
This is really, like, my heart aches hearing you guys talk about this, like both for you and your colleagues and for the clients who need you. Like what y'all do is that essence of life that really helps people keep their head above water. And
Absolutely.
If you are drowning yourself, there's no way you can help anybody else. What comes next? So you're currently, and I'm not quite sure when this will come out, but at the time of recording, you're currently 6 weeks into the strike. And have they set a bargaining date? Are they willing to negotiate with you? What's happening on the table?
No news as of yet. We keep on telling them, hey, let's come back to the table. Let's figure this out. And, do things. So we are, putting pressure of still being out on those strike lines. Still, like, patients are, you've seen them on TikTok saying, where's my therapist? How come, they can't get back? Members are complaining. People who have Kaiser are complaining and saying, I'm not getting the services that I need. So there's all these positions of pressure that are coming out to Kaiser because they can't sustain it. And you are an expert in knowing that we're in a mental health crisis, right? With therapists, right? So there's 2,400 of us, and you're going to continue to have the strike come out longer. You can't even cover half of that, even if it was 1,000. Trying to find 1,000 therapists across Southern California to just do consistently, you can't do it. You can't do it.
Yeah.
And I'm quite disappointed with Kaiser's movement at the table. And during our strike, we as mental health clinicians, no matter what we do, we know that the holidays especially are the hardest time for people in America. That's when we get the highest rates of suicidal ideation, depression, anxiety, feelings of loneliness, hopelessness. And Kaiser is not. I would think Kaiser would have wanted to come to the table knowing that our roles are very, very much needed, especially during these times, and try and work something out. We've offered dates, no dates, but yet they keep pushing out this narrative saying we're slow walking. Kaiser needs to explain what does it mean? What does it mean, slow walking? Because I know on our end we're offering dates. We're not even being responded to. Even before the strike began, our union offered dates in April. It said, hey, let's get to the bargaining table. We want to avoid any hiccups. Let's get this contract settled. Kaiser did not agree to a date until July 31st. So we can't even say July.
Nope,
they love to say,
August.
we started bargaining in July. No, it was July 31st, basically August. That's when they finally agreed to have our first bargaining session. And I don't understand how they thought from August to October was enough time to settle a contract. because on behalf of my fellow RNs, we came harder with what we wanted. If you look throughout our whole contract, there's little that provides for RNs in general, like tuition reimbursement, loan repayments, not even separate pay for having a bachelor's. There's several degrees we can get. I have what you call a generic associate's in science, but I know in current market practices, those nurses with bachelor degrees get paid a little more because they took the extra time to go to school and learn how to become more management minded because of the bachelor's, and they're not getting paid for it. Expecting all clinicians to train new hires, they're not getting paid for that, even though it greatly slows down what they're supposed to be doing during the day, because again, a lot of the inside employees are not crossing over into psychiatry because they know they're giving up benefits to do our job. I unfortunately didn't know that. They're not getting paid for all these extra things, and then every week it seems like Kaiser is adding on more responsibilities for our clinicians to do, but not actually wanting to compensate them fairly for it, all of us. So, I just want them to explain again, like, what's slow walking. Why do you think, 18% above market rate is great, but please explain how 5 years no one got a raise. Dr. Jared didn't get a raise for 5 years, but yet he showed up to take care of hospice patients. So obviously, we're doing this more not because of money or anything like that, but treat us fairly.
Yeah.
Exactly. That's it.
Yeah. And I mean, I think that 5 years showing up to take care of patients is more than enough proof to say, like, you're here for the patients. You're not here to be greedy, especially when your ask is, can you please treat us like you're treating everybody else?
Yeah, I think it is. And I will say, to kind of like, end with what Gina was saying, is that what's next is all this for our strike is, we know that the unwavering intention of any strike is that our action is that the status quo is no longer going to prevail, and that change is not only inevitable, but it's really demanded. And that all of us are sticking up for change not only for things that will benefit us and our families, but also change that is going to better Kaiser Permanente as an organization and give services that have been chronically understaffed and underutilized and poorly managed in their mental health fields and hospice and palliative care. We're just saying, here's our hand, partner with us. We actually are frontline workers who know what we're doing, and just listen to us, and let's have a collaboration and something that's really meaningful. And that's what it's about.
That sounds so open and focused on client care, and Kaiser's foolish to not accept that.
Yeah, exactly.
What can listeners do to help support the strike and support you all while you're on strike?
So we do have a GoFundMe. If people would be able to donate to our continuing fundraising support, join us on the strike lines, whether you're in the LA area, Antelope Valley area, the IE. We have strikes going on at different locations. And if you can stop by for a few minutes, an hour, walk the line with us, all are welcome. Share. We do our own TikToks and social media. If you could share those, that would be great. Just shed some light on what Kaiser is doing. I mean, it's important to be transparent to our patients. They're the ones who are paying these copays. They're the ones who signed up with Kaiser, and they're the reason why we're here. We want to be able to give them the care, the quality care that they are paying for, and making Kaiser take accountability for that, so they can always join in with demanding accountability from Kaiser. If their appointments are being canceled, they can file complaints with DMHE so that it can be investigated. They do take these complaints very seriously. We need to stop hiding the backwards shit that Kaiser is doing to cover up. Their whole goal is to prevent fines. During this strike, we want to say, no, you can't keep doing shady shit to patients in order to avoid fines. You need to be transparent. And
Yeah,
by doing that, it helps us because this is, you guys are the reason why we're fighting.
absolutely.
We want to be quality clinicians to give you the quality care that you are paying for.
Oh, yes.
And I'm just going to highlight that too, what Gina was said. I think just a simple thing, if those listeners are out there who are listening to this who are Kaiser members, or family members who are Kaiser members, and you're asking for a mental health appointment, or if you're at the hospital, your loved one's at the hospital and there's no social worker in the hospital, you complain because you pay premiums, you pay for these services that your medical plan is supposed to pay for, right? And Kaiser by law has to provide these. They can't say, oh, somebody will call you later. Or, you know what, yes, we'll get you an appointment, but it's going to be in 2 weeks. No, you fight for the services that you well deserve and your family pays for. That's what this is about. And Kaiser has said very clearly, no members will be adversely affected by our strike. So here we go. Have them prove it, right?
Yeah.
Have them prove it. So we would appreciate any of those types of things because we're doing this for them as well.
There's kaiserdon'tdeny.org. You can share your stories there too. And all the links for GoFundMe, the complaints to DMHC, they're all on that website as well.
Great. Yeah, and we'll include those in the caption for this episode. Gina, Dr. Jared, thank you so much for taking the time and talking with me today and helping our listeners understand more deeply about what the strike is and what you guys are really fighting for. I really appreciate it. Thank you both.
Thank you for having us.
Thanks for joining us. If you're in California and looking for a therapist, visit our website at openspacetherapycollective.com and book a free intro call with one of our therapists. If you're enjoying My Therapist Is Out, please rate, review, and follow us on Spotify, Apple Podcasts, and YouTube. My Therapist Is Out is an Open Space Therapy Collective podcast. We'd love to hear from you about today's topic, so email us at info@openspacetherapycollective.com. You can find us on TikTok and Instagram at Open Space Therapy Collective. Thanks for listening.